Hi everyone, I hope you guys are keeping well. In this video, I'm going to talk about chronic lower back pain. And if you are suffering from chronic lower back pain due to disc bulges, disc herniation, and if you're suffering from sciatica pain or any type of lower back pain that's stopping you from going back to your daily activity, this video can be hugely helpful for you. In this video, I discuss this issue with one of my in-clinic clients who suffer from lower back pain for quite some time, and she basically shared with you her experience in regards to her recovery and how I help her to basically recover and get back to daily activity pain-free. There are many of you who suffer from chronic lower back pain, and in many cases you've been advised to go get MRI report and get basically some sort of diagnosis, and in many cases you're not really sure where is the source of pain and how you can help to improve your pain. And in this video, simply you can get some information that can help you to improve your lower back pain and get back in your daily activity. If you've never been in this channel, my name is Bob, I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. Make sure to subscribe my channel for my weekly update. And if you find this video helpful, make sure to press that like button. Before we jump into the video, make sure to watch this video till the end. I share a couple of important tips at the end of this video with you that you have to follow if you would like to recover from this injury. Let's get started. I'm just gonna basically start from here. Like I suppose, Lilia, you've been with me coming to my clinic for a while. And I suppose today we want to share your experience of basically you were suffering with back pain and etc. for a while, and maybe just, if you don't mind, just share your story. What happened initially? What brought you to my clinic, and what was the plan? How did you find the plan? And today we are here, like you're feeling better, and I suppose I just want to share this experience with people like yourself who are suffering with lower back pain. And they're kind of confused what they have to do, what is the best, basically, I suppose, approach that they can do and plan that they can do. Would that be fair?
Yeah, sure, of course.
Brilliant. Yeah. Maybe just tell people just your story. What happened, Lilia, initially?
So I'm 34 years old right now. And my back pain started in my 20s, but probably because of my age, it didn't disturb me at all because it came and went away immediately. So the real problem started after 30. That's what I noticed, that the back pain was coming and not leaving me. Okay. And then each year it was getting worse. And the first time when I started to think about it was 2 years ago, when it was a COVID time and I was studying a lot, sitting a lot at the computer, and I started to feel that it really disturbs my lifestyle, my mental health, etc.
Of course.
So what I did to solve this problem, well, actually it's low back pain, and it started only from either sitting a lot at the computer or sitting on the couch when I was watching YouTube videos on my iPad, or just from sitting long,
Of course,
or from walking for long as well. For example, if I had my vacation, went to Portugal, and was just walking all day in Lisbon, and then in the end of the day, I had a horrible back pain.
I get you.
And it's like it was in like when the spinal cord, where the spinal cord finishes, like this point,
on the lower back, on the sacrum.
Yeah, exactly. So I tried to decide this problem by sport, by doing activities, be active, moving more often, etc. And I remember that when I was like in 20s, yoga really helped me a lot. So I decided to do yoga again, and I was cycling a lot as well, because I usually cycle, but eventually it didn't help me. So I started to look for other treatments,
Options.
probably to other options, probably to go to see the specialist. First, first specialist I tried was massage therapist. Um, well, it relieves you from the pain. It's true, but it doesn't solve the problem. So like it was better for me to do massage, but it didn't solve my problem. So the back pain. Again,
So you keep coming back basically after getting it.
Yeah, exactly.
Give you a window of like basically pain relief, and then as soon as you go back to do your things, you come back again.
Yes, yeah. And because the back pain was constant, it also stressed me a lot, you know. Besides that, I had physical pain. I start to be like more stressed because I can't do what I like. I can like sit a lot on the couch or in the chair. So I always have to stand up from my chair and walk. What is not convenient, because if I worked in the office and I couldn't do it all the time. So
I'll get you.
It really causes me a lot of problems. Yeah. And then I decided to check in with chiropractor.
Yeah, chiropractor,
Yeah, because my boyfriend actually did chiropractor and it helped for him. So I decided why not, you know. And I came to chiropractor and he checked me and he said that I have the shape with like the, how to explain that, I have this curve.
Extra lordosis, yeah. Okay.
Yeah, exactly. And it's like genetics, basically. You can't do anything with this. It's just like, it's not this, like, you just need to maintain, be active, do exercises for your back, and just do this.
Manage it, basically.
Yeah, manage it and just come to chiropractor. Yeah. So I start to go to chiropractor sessions. Actually, it's very short. It's like 10-15 minutes max. So chiropractor fix your
kind of like crack your back,
crack, exactly. So
manipulation on
horrible sounds. I wouldn't say that it was bad or like he didn't do his job really well, but I did 13 sessions with him. So I was 13. So I was very consistent. Was very responsible in this, you know, because I believe that it could help me. It didn't help me. Okay. So yeah, my back pain, just like maybe again, I got a little bit of relief, but the problem wasn't solved, you know. I understood. I talked to my boyfriend and I said, I understand my problem is not being solved, you know. They like I can't find the cause of my pain, and I want to find it because it will help me to solve the problem.
I get you.
And at that time, my boyfriend was attending your sessions, because he had the knee surgery.
Of course,
and he was really happy about
his recovery.
About his recovery, the way how he felt, you know, what the exercises you gave to him. And at one point I told him, maybe I need to try Bob, you know, I want to try your physiotherapist, maybe he can help me. He said, why not, just try it, just go there and ask. And so that's was my decision. That time I was working in the office. I was cycling every day. I was doing yoga twice a week, and I tried to stand up all the time from sitting. But it was there. The pain was there. It didn't help me, and I was a very unhappy person. Like,
I get you.
Trying to be happy, but at the same time, it really it also impacted my mental health as well.
I get you.
So that's how I came to you.
Of course, and how was the session, I suppose, from the first session? Because I think we had a different type of conversation on the initial consultation, you know, and I think you were a bit shocked out of what I was going through, and the conversation that we had. Maybe describe how was the initial consultation and what did you find? I mean, did you find it helpful? What was your experience like? Basically, a genuine experience that you had.
Well, in my case, the first consultation was like life-changing
Okay.
moment because first of all, what I was impressed about that you asked a lot of questions. You really showed the interest into about my my problem. You know, you were really interested. I saw that you wanted to help me. You know, and your questions were relevant. And they were smart. You know, like in
Thank you.
yeah, no, really, because I also like a person who always go deeper, you know, to the problem and try to find different approaches, like the
Of
complex
course.
approach to the problem.
Of course.
So that's why it was also important for me to see that you're not like just concentrated on my back pain. You just in general start to ask me about lifestyle, about stress, you know, like all these topics probably, which maybe
More
from
holistic, yeah.
from the first side it's not relevant, but then if you think about it deeply, it's very relevant. And I was like, immediately I felt that you are really interested and that you want to help me, you know. And then the second what impressed me is that you immediately noticed the way how I was sitting, you know. And
Yeah.
you ask me like, is it your usual way how you sit, you know? And I was sitting with the straight back,
Yeah,
you
yeah,
know.
yeah.
I
Very,
always
very
try
straight
to
up.
hold my back. Yeah, and
Yeah.
I never, because I had again this I tried to follow this advice, which I probably heard from somewhere like long time ago, that you
Of
always
course.
have to hold your back straight for your pose, you know,
Get
to
you.
look, for your posture, you know, that
Of course, you
you
have to
need.
sit upright to maintain like a good posture, I suppose. Yeah, that's
Yeah, good
very,
posture, yeah,
yeah,
exactly. And I never thought that that it causes me a lot of pain, you
and
know,
problems.
because my muscles are not ready to keep it straight all the day, you know, during the whole day. I just don't
Absolutely.
have muscles for this. My back is not so strong, you know, to keep
Yeah,
my back straight. And you recommended me to relax, you know, sitting when I sit on the chair to relax.
yeah,
And this already helped me a lot, you know. I mean,
yeah,
after I left your cabinet,
yeah.
next day I was sitting in the office more relaxed, and immediately I start to feel relief,
The
you
differences.
know.
Yeah, 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 yeah.
Yeah, and since that time I never tried to keep
Hold
my
yourself
maintain
anymore.
my back straight. Yeah, so, and it's just, you know, it's a
Good
life
to know.
changing
Yeah.
moment.
I mean, it's
Yeah.
very, very basic, but at the same time, it's very important. You kind of like explain it that way really well, because literally you hear these phrases of, okay, you have to sit straight, keep your back straight, your posture. Good posture is the always representative of person who's very straight and perfect. You know what I mean? But when you think about it, as you mentioned, those muscle hasn't been designed to be used all day, all long, and be on all the time, isn't it? They have to
Yeah.
have a time that recover, and you have to have your rest and work time, separated, which means you can't be always in work and keep them tight. And I believe, like, you got the message very clearly right away.
Yeah, exactly. Yeah, it impressed me a lot because I believed in this so much that it's just to read this was a big shock, you know, that it's not working. Actually, it doesn't work like this. That's what causes you a lot of problems. And of course, after this, I also felt much better mentally, you know, like
Of course.
psychologically.
Yeah,
Yeah,
yeah.
and then you did some checkup, you know, gave me some
Assessment,
exercises.
yeah.
Yeah, assessment, right? And you told me that I don't have any problems with my back. There is no traumas, injuries, or whatever. I don't need to do an MRI, whatever. I just need to strengthen my body, not only back, body in general, you know. And for
Absolutely.
this, I have to do the gym exercises. like in a smart way, like that helps me to strengthen my body and to do it consistently,
Yeah.
and not less than 3 times a week, which also shocked me because I was thinking twice a week is enough. You told me that in my case, it's not enough, that I need 3 times, and it really influences the way how I start to approach my training regime. Like I became so responsible, that I really miss my training now. And because I have personal trainer since long time ago, which we do online training, and I usually did training with her at home. So I came back to the gym. Before I went to the gym, but I was thinking, it's, like I can do it at home. But because you told me that I need to work with weights, because weights give me challenging, I have to challenge myself. And it was another thing which impacted me a lot, because what I noticed lately, that I was a bit merciful to myself, like kind of I don't want to do it, it's okay,
you're in the comfort zone, I suppose, like you're
very
in plateau,
comfort zone.
I mean, this is, we all get that, you know what I mean? We all get to the comfort zone and we plateau.
It really it does influence your mind. It doesn't mean that I push myself a lot and exhaust my body. No, it's in the way, like if I feel that I can do more, I can do harder, I do it, And so since that time, it was, I believe, October, I don't remember, September, October, when I came to you first time. And then I start, like, with my personal trainer. I actually, she knows everything about my problem. And I told what you told me, the way how we should train. So since that time, I train 3 times a week.
Amazing.
And my first, like, all this time, it was only improvement, but the back pain was still there. So it didn't go for 100%.
Exactly.
So 2 weeks ago, it's gone. The back pain is gone. I don't have it at all. Moreover, I sit at the computer now much more often and longer than I used to do it before. And it's not there. It's not coming to me. It's just like, I don't feel it anymore. And this is a miracle for me, because every time I was sitting at least for half an hour, every time the back pain told me, hello, I'm here. Now I'm going to disturb you. Now it's gone. And I can't believe this. I'm like, really?
That's amazing.
That's amazing. I mean, and this, I told also my trainer and to you, Bob, that this is not just my back pain is gone and now, like, I feel good. It's a mental state when you every day feel satisfied and great that you can work, because I'm very enthusiastic about my work.
Absolutely.
And I invest a lot of time and energy in it. Like, it's a great feeling that I can spend my time to what I love to do, and not think about obstacles. Nothing disturbs me. I mean, 100%. I work as I want,
Absolutely.
Plus, it's like, I feel like, like I was born again, something like this. I'm so happy every day that
amazing.
I work more and more, and I notice that my productivity is just gone to the sky,
That's amazing. That's amazing.
And
that's amazing.
So it's not just back pain is gone. It's like, it gives me much more opportunities, and advantages. And I always, like, feel grateful to you, Bob, that you, like, told me all these words, and you, like, really you are professional in what you're doing.
Thank you.
You didn't give me any hope, you just told me that it's a consistent work, and it's like a lot of my responsibility there, and you gave me a new life, I
I'm
would
happy
say.
to hear that, but I suppose at the
Yes.
same time, I think, Lilia, you really stick to it. You know what I mean? You really were consistent and you took it seriously and you invest on your time, and you realize, okay, I have to actually get stronger and build more resilience and just get out of my plateau and just do something a little bit more than what I used to do. You know what I mean? And I think information and knowledge helps that to be kind of like create clarity in your mind that there's nothing mechanically wrong with my back. You know what I mean? And it's more like literally I have to build up myself and get out of my that comfort zone. I mean, you were still active, you know what I mean? I suppose you weren't like sedentary, but you needed to build up your body a little bit more based on your daily activity. And that would kind of
Yeah.
like help you to kind of like see the differences. And what you do right now is not about just getting a fix from somebody. You are actually feeding your body in a different response, and you're literally taking care of your body a little bit more in a sense of that you have a routine that you follow on a weekly basis. You know that you're by sitting, by slouching, you're not damaging your back, or you're not popping out some disc or something. That's the phrase that they use. You know what I mean? Or you know what I mean? Which means you have more confidence and clarity. I think that
Yeah.
would that did hugely help you as well. And I mean, I haven't fixed anything. You know, it's more that you really take over and you were responsible about it. And plus, like you would like the challenge of doing actually more activity. You know what I mean? Look at it that way.
Yeah. Yeah. Absolutely. Yeah. Yeah.
And
Yeah.
then, sorry, go on.
Yeah, and like now I come to you to do sports massage, which is
Mm.
also absolutely great.
I'm happy to
It
hear that.
Yeah, gives me a lot of also advantages like the pain relief, because still I
Mobility.
have pressure, yeah, like tights and in my body, and
Yeah. I
yeah,
mean,
it's
but
like
you're very
all
active
it's
now. Yeah,
yeah, it's all together the complex approach, which you have also um in the way how you treat your clients, like it's
of course.
complex approach, not just you have to fix exactly this part of your body,
Exactly.
that's what it
Absolutely.
works. Yeah,
I mean, I
that's how it
mean,
works.
absolutely. I think this is really important as a message that I think you giving people today on this video, because technically speaking, like I treat a lot of people with back pain online or in clinic, and I think this is a huge thing that you mentioned just now, that you can really fix back pain with a treatment or a method to just click things in and fix them. Not really. And if they even get better, it's very short term, because they haven't basically earned that improvement. They didn't do such movement and exercises, and hugely that can impact their mental aspects, which means they never gain confidence by doing nothing. You know what I mean? When you start to
Right.
do more, you physically and mentally start to feel better, and those adaptation are definitely will show up in some stage in your life, which means 2 weeks ago you start to feel better, and you mentioned you went away and you were walking a lot, and everything was fine, isn't
Yes,
it?
yeah. Yeah,
Yeah.
I had a trip, city break trip, and also was sitting a lot in the car there and was walking, and all of the stuff I do during the vacation, and
Yes.
just I forgot, like actually I reflected on it after I came back to Dublin, and I was like, oh, I didn't have any problems with my back.
That's
First time
amazing.
in many
I
years,
know.
yeah.
I know.
And
I was.
actually, this challenge word, yeah, which you told me, you have to challenge yourself. You can't imagine how it impacted me. I also didn't expect this, but I don't know, some puzzles just, match to each other.
Yeah.
Because, for example, now I'm a little bit sick, but not in the way I have flu or something. Just last week, my throat started to hurt me. Then I start to cough, But in
Yeah.
general, I feel good. Before, I would stop all trainings. And I would say, I'm sick, I will not do it,
Yeah.
And
Yeah.
now I continue doing my trainings. I keep my regime, but it just we do it in the light version. We do like
Amazing.
mobility, stretching. So my body still moves, still
Active.
do
Yeah,
exercises exactly,
I get you.
and this is my challenge. That's what changed in my
That's
also
amazing.
attitude. Yeah, to myself, to
Absolutely.
my physical activities. Yeah.
No, that's so important, Lilia, and I'm happy that you're talking about it because it's a personal choice, and you really need to look at your perspective and your image that you have about your body, and we are. I mean, this is something that I tell to all of my patients that we are adaptable as a human, which means you can be adaptive in any way that you want. Most of the time, if you look at it, and people rest and protect and they adapt to weakness and weaker lifestyle, and the other side of the scale is that gradually building up and not just get stronger physically but mentally you become bulletproof. You know what I mean? Which means even if you get sore in some stage in your life, that's part of life. And I never claim that you gonna be perfect. You know what I mean? There is no stage of perfection. We are human, we active, we get sore, and back pain is something that is very common. You know what I mean? And in some stage, you're gonna get back pain in your life. But when you have an idea, okay, how am I gonna be able to control and manage it? In my day-to-day, you don't panic and you don't just take bed rest and expect to get better. Does that make sense? Which means
Yes.
you slowly become a little bit more build resilience and get basically kind of bulletproof physically and mentally. You know what I mean? And it's great to see
Absolutely.
that. It's great to see that you're mentioning about it, because that's the mental part of it is hugely impacting people, and they get worried about it. And for somebody like yourself who have had experienced chronic back pain for a couple of years, you know what I mean? That can be very debilitating, because in your mind you can go and sit down and search on Google for hours and read all of these scary terms and things that people like usually write, you know what I mean, and as experience or as a blog, etc., and can get panic about it. You know what I mean?
Right. Yeah.
And adapt to the other side, that you say, okay, I'm not going to do anything, I'm going to protect myself and actually just mind my back. But right now you're active, you are doing kind of like a regular exercise in a weekly basis, and I think you feel good about yourself and your body again. You know what I mean? And your whole mental image about your body and your back has changed. That's how I see it.
Absolutely. I even went further. I did pictures like 2 months ago in bikini, just to see how my body look.
Yeah.
And then like we already had the pictures 2 months later, and I found a really big difference just 2 months.
Amazing.
And
Very
it's not
good.
about
Just a
losing
picture.
weight or whatever.
Yeah.
Yeah. It just, for example, my belly is not so loose anymore because I strengthened my hips, my
Yeah. You got
like
stronger. Yeah.
yeah, and it's just holding my muscles holding, so my belly is not going down,
I know
and
what I mean. Yeah.
yeah. Or for example, I like one shoulder is lower, another upper, so and now it's also better.
Yeah.
In general, you see this difference, like you see that the body is stronger now, and
Of course.
I believe that most people who have the back problems, and they try to solve it with different specialists, different treatment, they forget that they also should do something for this. The strong body is the key to help you to overcome your problem. I
Absolutely.
mean, you can
Absolutely.
invest a lot of you can be super professional and understand everything about back pain and do everything for the person
Of course.
to solve the problem. But if you don't do it also on the daily basis, something, it doesn't work. You should also,
Absolutely.
yeah, it should be like all together.
100%, 100%. I think I don't need to add on anything on top of it. You're damn right. And like literally, you can achieve whatever you want. It's your responsibility to look at it. And there is some help out there. You know what I mean? And like honestly, I think what I see here, that no matter where your level of fitness is, you can still build up and progress.
Right.
You
Yeah.
know, it doesn't matter where you're at. You know, I have people online that they can't walk, and we get them back into a fair pain-free zone that they can actually believe that they're going to get better. And then now you end up seeing them in the gym, you know what I mean, in a couple of months time, which is amazing. And that shows me a lot of belief, and cause a lot of beliefs for me that how adaptable we are and how we can progress. There's no I suppose there's nothing is impossible. You know, that's how we look at it. Yeah.
Right. Yeah. Yeah.
Lilia, this is great, man. I mean, thank you so much for putting all the time, and I'm delighted with your results. I want to know, Lilia, is there anything else that you would like to add on to today, I suppose, video? Because I suppose we have time, but I want to know, is there anything else that you'd like to share with people?
Yeah, I just want to thank you, first of all.
No problem at all. No problem.
Yeah,
I'm really
because
delighted to
you
see
like
you.
literally changed my life. You
I'm
know,
happy
the
to
way,
hear that.
yeah, like first consultation, and you already like gave me a lot, you know. And so, and I believe that because you didn't give me any diagnosis, you know, it also helped me um to think a lot about my back pain problem. And basically I just start to do to follow your recommendations, you know, and I start to see improvements immediately. And then it gave me more belief and hope that if I continue, I will help myself, you know.
Of course, yeah.
And yeah, and and it helped in the end. And I really think it's like, for me it's like a miracle, but it's not, because it was a consistent also
Work,
uh,
yeah.
work. Yeah.
And journey,
And
yeah.
yeah, so I think it's really important to stop thinking about your back pain and do something for it, you know. Just
Absolutely, you're damn
yeah.
right. Yeah, and like you're so perfect in what you said just now about diagnosis, because diagnosis is something that whoever profession that you go, I don't know, there can be physio or chiropractors or physical therapists or neurosurgeon or whatever, and they try to. I mean, we're always looking for the cause of pain. And you're so right, because not always we can make diagnosis of things. And if I be honest with you, I rarely make diagnosis when I see my patient with back pain, because in majority of cases they are worried about their MRI, because they've been diagnosed with a disc bulge or herniation, which is very common in majority of population. And then they and the issue with the MRI is that the MRI never shows a source of pain. You know what I mean? Where is the source of pain? You can't really say, okay, this is a source of pain. And in that sense, you looking at like people always going to be worried about if you make a diagnosis of based on your test. And the test that we have right now in diagnose, I mean, the orthopedic test that we have in clinic, they're not very specific or like sensitive to be able to really make a diagnosis of somebody. Yeah, we believe certain things does give us some answer, but there's so many other factors that cause pain. And the pain is a very multifactorial, like your lifestyle, your sleep, your stress level, your social support. You know what I mean? All of these can cause and influence pain, and we know about it now. And that's why we can't really always correlate pain with tissue damage. You know what I mean? And that's why it hugely changed the perspective of, okay, where is the source of pain? But that's amazing, Lilia. Thank you for actually bringing this up, because this is hugely important for people like yourself to know that pain is multifactorial and is not always due to tissue damage. And specifically, when we talk about chronic lower back pain, in majority of cases is not due to tissue damage, you know, but the pain is lingering there because of other things that you probably don't do or you don't know about them. And you got to make an action, as you mentioned. You always have a choice to do something about it rather than waiting for things to get better.
Yeah, absolutely, I agree. Yeah.
Amazing. Lilia, it's been great. Thank you so much for help and giving it time. I'm happy to see you in this stage, and we're not going to stop your training and your program here. You keep pushing forward, and I'm delighted that you're doing better in work and your overall day-to-day living. I couldn't be happier. And thanks again, Lilia. Is there anything else that you like to talk about for today?
It's just like let's have this interview in 1 year because we have
I
to
know.
check
I would
in you
love
with the
to. I
result.
would love to.
Yeah,
Let's do that,
yeah,
honestly, because this is another thing that I try to now actually highlight as well. You're spot on because I always tell my patient that being pain-free is not necessarily that difficult. You can get pain-free, but staying pain-free is so important because
yeah,
that's the part that you learn more about your body and understand what activity or things that bothers you, back pain, let's say we're talking about back pain, and how you can monitor and actually modify your daily activity and get better in it
yeah.
and manage it rather than to fixing it. Does that make sense?
Right. Yeah,
I'm looking
absolutely.
forward.
Yeah.
I'm looking forward to do it again next year, Lilia. I'm up for it,
Yeah.
100%. We're gonna definitely do it either in clinic or online because I think Zoom is very convenient at the moment. But
Yeah.
I'm looking forward for that. Thanks again, Lilia.
Yeah.
Listen, I
Thank you
appreciate
so
your help.
much, Bob.
Not at all. Thank
Yeah.
you. Thank you. You're very good. And we'll chat soon. All right.
Yeah.
All right, guys. I hope you guys find this video helpful. If you have any question regarding your low back pain or your basically lower back injury, you can leave me comments. I would like to share with you before we finish this video 5 important tips that you have to follow if you're suffering from chronic lower back pain. The first tips that I would like to share with you guys that you do not need MRI scan if you are suffering from chronic lower back pain. Why? Because a study and research highlighted that in majority of cases, if you're suffering from chronic lower back pain, your back pain is tend to be more due to your way that you basically has been changing your lifestyle and you have been treating your back, and it can't be in majority of cases be something sinister. A very little amount of low back pain can be sinister. We're talking about 1% out of total population back pains can be sinister and they need urgent care and they probably need MRI scan for diagnosis. If you're suffering from chronic low back pain, you can literally avoid MRI report if you're going to a right place and consult with a right physio. The second tip that I would like to share with you guys is that pain is not always equal to damage. If you're suffering from chronic lower back pain, in majority of cases, your pain is protective and you can't really say that I hurt my back after doing something. It is very normal to have some sort of pain and discomfort after adding some sort of new daily movement and activity to your routine. And I always try to educate my patient that you will be probably a little bit sore after doing this series of exercises, but that's very normal. By doing this, after a couple of days, your body adapt and develop and improve that discomfort, and you're never gonna feel that again. If you're suffering from chronic lower back pain, and if you're suffering to start and you don't have any structure or plan, you can always contact me and I would be more than happy to start you on some sort of structure and plan and get you back in action. The third tips that I would like to share with you guys in this video is that complete rest, unfortunately, doesn't help you to recover faster. If you're suffering from chronic lower back pain and your pain has been there for a while, unfortunately, what research and studies support is to stay active as much as you can and avoid complete rest. If you're not sure what type of exercises that you can do or what you shouldn't do, I will leave a link below in this video that you can literally check a couple of examples of exercise that you can start. But if you need something more exclusive and customized for your basically injury, I would be happy to sit down with you through an online consultation. No matter where you live in the world, we can organize a session and we can sit down and talk about your case and prepare a customized plan to get you back in action. The next tips that I would like to share with you guys is that if you're suffering from chronic low back pain, you have to look at your lifestyle beyond just your low back pain, which means your stress level, your sleep, and your beliefs and your diet plan can highly impact your pain. I've prepared 10 important facts that if you are suffering from lower back pain, you can watch these 10 facts about lower back pain that I've explored these symptoms and these facts about lower back pain that you can watch them in details. I'll leave a link below in this video that if you would like to see these in details, you can watch this video. It's a little bit longer and I've explained why you need to watch your lifestyle factor such as stress, sleep, diet, and your social support to help you to improve your pain and discomfort. The last tips that I would like to share with you guys in this video is that getting help from professional who is familiar with chronic lower back pain is crucial. If you're suffering from lower back pain and it's tend to stay there longer than 8 to 12 weeks, you have to ask some help from somebody who is familiar with chronic pain, and they can educate you about pain and discomfort, because pain in chronic pain is a little bit different from just average typical acute injuries that you get in a day-to-day lifestyle, and they can help you beyond just showing you the exercises, and they can educate you about your pain. In this case, I hugely see many patients with chronic lower back pain, and I help them one-to-one to get an understanding about pain. And if you're interested to get help and a structure about your plan, you can always contact me with the link below. I hope you guys find this information and this video helpful. If you have any question, leave me comments. And if you haven't subscribed my channel yet, make sure to subscribe. I really appreciate your help. Share this video with your friends and family who may need this information. If you haven't pressed that like button, press that like button right away. I really appreciate that. And I hope you guys find this video helpful. Thank you so much for your support, and I see you guys in the next week. All the best.